Welcome back, everyone. Kristin is with us today, certified nurse practitioner with Lima Memorial. We've been talking a little bit about Lung Cancer Awareness Month and some of the things to look for there. We talk about the risk factors. What are some of those things that we might have had in our lives that could be risk factors for lung cancer?
So the number one cause of lung cancer is, of course, smoking. The other thing are environmental toxins, family history, genetics, things like that play a role. What we really focus on is people that are either current smokers or previous smokers within the last 15 years that have a 20-pack-year history and are the ages between 50 and 80. And those are the people that we really target to get screened.
As you'd mentioned, it's the most deadly type of cancer that's out there. It's very scary to hear some of the stats, but we talk about symptoms and things that people might notice that's out of the ordinary. What are some of the symptoms to look for?
So the most common causes or symptoms of lung cancer include unintentional weight loss, coughing up blood, and presence of a new cough, any trouble breathing, increased shortness of breath, anything that's out of the ordinary for your breathing that really makes you go, that's not normal. It's definitely something to get checked out.
As you said, get it checked out because we need to catch it early. That's the big key. What technology do you have and what do we have here locally that allows us to do that?
So here at Lima Memorial, we have a low-dose CAT scan, which uses less radiation than a traditional CAT scan. It is considered a screening or preventative medicine, so insurance companies typically cover that. And so we really encourage people to get that done because once we have a nodule, we have the technology here at Lima Memorial to get a diagnosis and a tissue biopsy quicker. Usually we try to get these patients in within about a week to try to discuss our treatment options and even diagnosis techniques.
Yeah, you've talked about that two-prong approach where we have that screening available to catch it early and also prevention efforts. What are some things in our daily lives we can do to maybe prevent the chances of getting lung cancer down the road?
So number one is, of course, don't smoke. If you don't smoke, don't start smoking. If you are smoking, there are options out there that can help you stop smoking. I know right now COVID is a really hard time for people to stop smoking because you're at home, anxiety is really high with people. And so it's kind of their medication to try to get through this. And so we really need to offer, what can we do to get you to stop smoking? How can we support you? And there are support groups out there that are available.
Yeah, I think that's what people love. You start from the screening all the way to the follow-up and the treatment and follow us all the way through that process. For those out there who are watching today and they think, okay, maybe I've got some of these risk factors or even some of the symptoms you mentioned, what's their next step?
So the next step is to talk with their primary care provider, or if they have a pulmonologist, their pulmonologist, to determine, are you a candidate? Is that something that the provider is willing to, order for them to get this screened? It's also, if you don't have a primary care provider, now is the best time to get one. Lima Memorial offers some great primary care providers that are more than happy to see you and get you in and get you the screening that you need.
All right, the process is a good one. You guys follow us all the way through. Kristin, thank you so much. We appreciate it.
Thank you.
Nice chatting with you. We'll be back after this.